Welcome back to my channel, Nurse Great. Okay, we're gonna just hit it. One thing I just really realized as a nurse educator is that there are truly no educational emergencies. Now, if you are new to being a nurse educator, or if you are being pulled from the unit to help with some type of educational offering, understand that there are no such things as an educational emergency. Now, we understand that if any regulatory body will come to your department, to your hospital, there may be some just-in-time training you might have to just pop out real quick, or some educational offerings that you might have to do leading up to their visit. If you know they're going to be there in 2 weeks, well, hey, these are some highlights, some things that we need to work on. Our numbers have been XYZ with this report, with that report. You just want to brush up on the skills to make sure your staff is knowledgeable. I get that. But what I don't get is when someone says, well, I don't know how to do this Foley catheter. I don't know how to insert. I don't know how to remove it. I don't know anything about Caudy bundles or anything like that. And then now it's like, nurse educator, did you train them? Did you teach them this information? And you're like, yeah, I taught them. But why they ain't getting it? And then it's like a back and forth thing. It's crazy, because just because you teach, and it's, y'all, it's probably the same person or the same couple people that you run into. The unit has issues with, the supervisor or the manager has issues with. Maybe this person has terrible documentation. Maybe this person isn't using sterile technique for something. Whatever the case is, it's generally the same group of people who complain about things that poses a, make it seem like there's an educational emergency because they didn't get it. But if you look at the other team members, 90% probably of that team get whatever that topic is that you're teaching, whatever the task is or the skill is, but the same group of people aren't getting it. And every time they don't get it, it's an educational thing versus an accountability thing. Like I mentioned earlier, they do this thing. When I say they, I mean managers or supervisors or department leaders. They do this thing where they're asking, especially for our nurse residents, LPNs or RNs, did you teach this in residency? Well, you only can teach so much in residency. I don't care if the residency is 35 months. A lot of them are 20 months, depending on what the specialty is. I know for postpartum, it's 16, where I am, it's 16 weeks. For special care nursery or NICU, it's 20 weeks. For L&D, it's, I think, 20 weeks as well. So it just depends on where you are. You still cannot teach them everything they need to know. They will need to have some type of opportunity to learn certain things while doing the act, while performing, while taking care of those patients with their preceptor. Because you, as the nurse educator, if you're teaching them every single thing, well, what do I need the preceptor for? The preceptor is there to kind of help bridge that gap, to provide inquiry, to answer questions, to show them how to do tasks, especially based on that department. Learn policies, things like that, how to access things, how to navigate the system, social engagement, all of these types of things is what they're learning on the unit. So yes, you could teach as a nurse educator and teach 50 different topics, but there still will be some things you just cannot teach because you're not in the mix. You're not on the floor with them every single shift, and you don't know what's about to pop off on your 12-hour shift. But I have a suggestion. When the manager or the supervisor comes to you and says, Shaquila, can you teach this nurse resident about Foley catheter insertion? It seems as though she isn't getting it. It seems as though she's not understanding proper sterile technique, etc., etc. First thing you can ask is, well, help me understand, why should I, as a clinical educator or the nurse educator, why should I teach just this one person? Is it a ongoing thing? Is it just this one person that always has this issue? Or is it a group of people? Or is it a, here and there, it's a ebb and flow of people not understanding this certain skill? Once they give you that information, then you say, well, hey, let me see that data. Let me see, I want to track and see where, where we were from fiscal year 2022 to fiscal year 2023. I want to look at the CAUTI infection rates. I want to look at how many admissions we've had, how many readmissions we've had. I want to look at that data. If they cannot provide you that information, go ahead and ask them, when you get that information, I will be more than happy to review it and to see what the gaps are that those learning needs are. In the meantime, keep doing what you're doing. There's only so much, like I said, as an educator that you can teach during residency. And don't feel so obligated to jump on every, well, I'll do it. And your plate is probably already 99% full. And here you are trying to squeeze on more things that probably shouldn't even be on you. Nurse educators, I want you to get used to leaning into difficult conversations. If there's, an issue with you having conversations with people that are difficult, that you may seem that you're going to come off abrupt, or you don't want to seem like you're being mad or upset, you don't want to make the other person upset, I totally get it. I understand. However, what you need to do is pay attention to what it is that you required to do based on your job description and focus on that. Now, I'm not saying you can't go above and beyond. Yes, you can, but you got to realize that if you're going to keep piling things on your plate, at some point you're going to tire yourself out. You're going to mess around and probably be sick because you're not taking care of yourself because you're taking on so much. And then you're rolling. So 3 months, 6 months, 9 months, a year down the line, and you're just been going at this really, really fast pace. You haven't even had time to really digest all the crazy things that you've done over the last year. And now you're about to be out on FMLA or what have you because you're just physically ill. And you don't want to get to that point, right? So, I just thought about this. Another thing I just saw the other day that a counterpart had gave me, and I think it's in the nursing professional development textbook as well that Mary Harper wrote, but there is a such thing called the decision tree. Now, the decision tree is basically what you could present to that manager and or supervisor when they ask you to create a whole in-service or a whole teaching, session for these few people who keep messing up skills, and maybe they have a knowledge gap, and so you're the one who they deem that should do it. Have that decision tree. I'll try to insert a slide. But the decision tree basically says, is this something necessary? Is it not necessary? Did this person already receive education for it? And if they did receive education for it, why are they not hitting the necessary, components of that particular skill? If they didn't receive education for it, well, that's the problem to begin with. But keep in mind, you are not their nursing instructor, you're not their professor, their clinical instructor or their professor or anything like that. So you're not reteaching things to them, but you do want to ensure that they understand what it means to be, sterile, to have all the supplies, to educate the patient, to comfort the patient when they're doing this type of procedure, or any task or skill. So have that, and that tool, I'm doing all this like you know what I'm talking about. But anyway, I will insert a picture so you can know exactly what I mean. But utilize that decision tree, and it will probably save you 50% or higher of doing those extra tasks and educational sessions that you probably weren't even going to do or needed to do to begin with. I don't know why, but that was something that was on my heart, and I had to talk about it. Accountability, decision tree, educational emergencies, so much. All right, guys, thank you so much for watching. Listen, click some more of my videos. Go around, find something you like. I talk about education, inspiration, faith, God, the whole works. I love you. Thank you so much for watching. I will see you in this video next.